Recording there, Mike?
Yep, go ahead.
Welcome and thank you for joining part one of Seyfarth's micro webinar series, Hot Topics in Employment Law for Massachusetts Healthcare Organizations. This installment of the series will focus on pay equity. All participants are in listen-only mode. You are encouraged to submit questions throughout the program using the Q&A feature located on the right side of your WebEx window. If your question is not answered during the webinar, our presenters will follow up with you directly in the days ahead. For those interested in CLE credit, an attendance verification code will be read during the presentation. Please write this code down. It will not be repeated and is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees following the presentation. At this time, I'd like to turn the program over to Kristen McGurn. Kristen, you may begin.
Thank you, Dave, and welcome everyone. We know how busy you are and appreciate all that your industry is doing for all of us during this ongoing, difficult time. We know that your teams have been on the front lines, and as a result of that work, compensation issues generally and pay equity in particular are thorny issues that we all have our eyes on. We're here today to do sort of a lightning round on topics that we're seeing in this landscape of pay equity, a shifting landscape, both across Massachusetts and really across the country. And with me today, I'm Kristen McGurn, a partner in our Boston office, which I co-manage. I'm also one of the co-leads of our national healthcare practice, which is an interdisciplinary group of attorneys bringing their expertise to your industry. And with me this morning is Hillary Massey, who's senior counsel in our Boston office and is one of our foremost experts in pay equity and is a member of our local healthcare group focused on that issue. So we're very grateful to Hillary to bring her talents to us today and to talk with you all about these issues. As Dave said, we want this to be interactive, so if you have questions, please feel free to type them into the chat and we'll try to get to them as we go. But we are here only for half an hour. We want to get you back to your lunch hours. And so if we don't get to one of your questions during the session, we'll certainly follow up in the days ahead, as Dave suggested. Next slide, please. The agenda for today really is to focus on these 5 issues, both state statutes that are, being modified across the country and distinguishing themselves from the federal Equal Pay Act, salary history bans, which is really the sort of don't ask kind of legislation that we see now rolling out across various states. And we've seen that for a while here in Massachusetts. We'll talk about, how that landscape is shaping up. And as you know, pay reporting and pay transparency laws are starting to surface, and Hillary will help us understand whether that's likely to face us here in Massachusetts and the New England states, and then we'll certainly close with best practices and some recommendations for you as you navigate these waters in the healthcare industry. Next slide, please. So with that, we'll turn to the equal pay laws and the trend, number 1, which is they're getting tougher. And with that, I would just ask Hillary if she can maybe give us a history lesson on state equal pay protection trends, sort of the why of it, and where is this happening, and what have you seen and what can we expect? Next slide, please.
Great, thank you, Kristen. So until just about 5 years ago, there was really just a generally unknown and unenforced provision of the federal Labor Relations Act that prohibited employees from discussing their employment, their compensation, prohibited employers from prohibiting employees from discussing the compensation, but there was no real effective law on the subject. It wasn't really enforced, and there was a lot of secrecy around compensation. It was really just the norm. And so since then, we've really seen a cutting edge of pay equity legislation in the states. And so this slide talks about that wave of changes that we've seen really since 2015, 2016. It started in the usual suspects, the coastal states, California, New York, and Massachusetts, but really has spread across the country. And there's some unique issues. We won't touch on the specific requirements of the different laws, other than to say that they really are stricter than the federal law in several ways that we'll talk about in a moment. But the reasoning behind these laws was that there was perceived and real pay discrimination based on gender, and an effort to address it in sort of a different way, which was through addressing some of the informational gaps between employers and employees. And so some of these different new laws that we'll talk about really get at that unequal access to information that employers had in the past as opposed to employees. And so that's the reasoning behind the types of laws that we'll talk about today. And of course, the overarching goal is to remediate, eliminate pay inequity based on gender. And so the states do that in a few different ways. What I'll say, though, is that we aren't seeing very much litigation around some of these new trends and new efforts. There are some Massachusetts equal pay law litigation, but not as much as we expected to see a few years ago when this came out, when there was a real flurry of activity. And there hasn't really been any court decisions addressing the laws. So in other words, the few cases that were filed were settled quickly without any real input or insight from the judges. So the next slide, please, we'll talk about some of the differences between the state versus the federal law. So you can see the Federal Equal Pay Act is on the left there, and an overview of the state laws on the right. And of course, it varies by state, but they are stricter in several ways. One being that they're not just about gender. They also have other protected categories. And also, they require employers to pay employees who do comparable work similarly, as opposed to equal work equally. So it's a more employee-friendly standard. There's some other unique aspects of these laws. So for example, the federal law allows pay differences to be explained by any factor other than sex. So for example, an acquisition could be used to explain a difference in pay, but some of these state laws would not allow that specifically. So including in Massachusetts, that's not one of the limited factors that are covered under the law. And then also Massachusetts has a unique affirmative defense. In other words, if employers do a reasonable good faith pay audit, then they have a defense to liability. That is not available under the federal law. So that's one way in which the employer community was really able to get something beneficial under the state law. And it's a unique issue that also hasn't really been litigated. So we don't have much guidance on it. But we will talk more about privileged reviews today as a result of that affirmative defense.
And Hillary, you mentioned just a unique issue, and I wonder whether there are unique requirements from your perspective with respect to healthcare organizations. Is there anything about the industry that makes these laws apply to them differently?
One thing that's really a challenge about this industry in particular is that some of the just well-established practices in the industry are not addressed by some of these state laws. So for example, I mentioned that the Massachusetts law has explicit factors that employers can point to explain differences in pay. And one that is not a factor in the list is unionized status. So meaning union employee versus non-union employee. Now we would say, representing employers, that a collective bargaining agreement encompasses the factors that are allowed by the law. So tenure, merit, that sort of thing. And so we would be able to point to those factors through the bargaining agreement. But the important issue to keep in mind is that this just hasn't been litigated, and union status is not in the very short list of factors. So that's one thing that a lot of our healthcare clients have had to think about. There's also factors that our healthcare clients may rely on to explain differences in pay that are not set forth explicitly in the Massachusetts law. For example, academic rank. That's one that we see all the time when we do pay audits for healthcare and academic institutions in Massachusetts. And that's, again, academic rank is not in the short list. Now, we would say that there's equivalent factors in the list, like experience, education, tenure, could sort of be seen as equivalent to academic rank, but it's not the exact factor in the statute. So that would have to be addressed at some point by the Attorney General's office or a court, and it just hasn't been. And then there's things like specialty. We assume that would be an appropriate factor to use to explain differences in pay, but it's just not the word that's used in the statute. And then we see that a lot of our healthcare clients have dispersed systems. So they might have several hospitals in a region. And I use region loosely. It might be several hospitals within the Boston area. It might be within the state. It might be within surrounding states. And so we know that geography is one explanation for differences in pay, but we don't have very clear guidance about how far you can reach to use geography. In other words, taking the conservative approach in our pay audits, we would lump at least all Boston area locations together, if not all Massachusetts locations. And we would even consider regional locations depending on the risk tolerance of our client. So that's just to say that to the extent that, hey, there are significant pay issue differences among hospitals, for example, in Boston versus maybe on the 495 loop, then that's something that we recommend thinking about carefully because it hasn't been addressed in litigation or in the statute.
Yeah, and one of the other things that we would recommend thinking about carefully, and we'll talk a bit more about how to undertake this self-audit and affirmative defense at the end of our slides, but is this notion of bringing people together within, let's say, an academic medical center or other environment where you're bringing in talent from, the pharmaceutical industry or research labs, and blending them sort of in the workforce with physicians or others, other clinical staff or others, and the extent to which those nuances need to be accounted for as you study equity within your pay structure. So complicated issues, here to help, of course, and more to come in terms of seeing how the law is going to evolve in the courts. We are seeing, as Hillary said, a bit of an uptick in this sort of litigation, but far fewer cases than we anticipated initially. But soon enough, we expect to have some judicial guidance based on actual cases pending in court right now. Next slide, please. We'll move along to state trend number 2, which is the kind of don't ask legislation, the salary history bans. These have been around for a little while in Massachusetts, as you likely know. Hillary, how are healthcare employers dealing with these requirements in Massachusetts and across the country?
Great, thanks. I think we can move to the next slide. So I think most of our clients or all of our clients are definitely complying by no longer asking about compensation history, but then also thinking more proactively about how to address potential differences in offers that applicants get. And so just to touch base on what these bans are, I'm sure you've heard of these. The Massachusetts one passed in 2016, so it's been in effect for a while, prohibits employers from asking for an applicant's compensation history, either from the applicant or from the prior employer. Massachusetts law is one of the first, but there's others in the region and really around the country now. And so the goal of these laws is to avoid perpetuating past discrimination. So, the assumption is the compensation may have been low in the past because of discrimination, and we don't want to continue that. And so employers cannot ask about or rely on compensation history to make an offer to an applicant. And we haven't seen enforcement of these laws really either. So we don't have much guidance about it, but there's less kind of open questions for employers, I think, as to how to apply this. But the difficulty is more in how to avoid disparities in offers made to applicants. And so we see healthcare organizations in the region dealing with that by really trying to get some good structure around their compensation practices. And so to the extent there's not already a grading structure with salary ranges associated with different grades, then we would recommend thinking carefully about getting that into place, because when hiring managers are, kept within a range for their making offers to applicants, then we can avoid any sort of perpetuating discrimination based on past compensation or anything else, really, because managers have to stick to that very strict guidance. And I'll tell you that that's a difficult process. If this grading isn't already in effect, it's definitely not an easy thing to put in place, but it's well worth the effort thinking about going forward and eliminating pay discrepancies and avoiding any kind of complaints or litigation around this. And so this also will help with the next trend that we're going to talk about. Kristen, you want to talk about the next one?
Sure. This is really the pay range disclosure laws, sort of going on that transparency theme. We've seen a lot of that in the past couple of years. Legislatures and employees really clamoring for more information, and we see this. Our international colleagues, help us understand how this is working outside of the country. There more transparency now being demanded here in the U.S. And this really, some states and cities are now requiring employers to provide the pay range to relating to a particular role to applicants. So I guess, Hillary, with so many different requirements to track the transparency, the reporting requirements, the don't ask sort of policies, how are healthcare employers coping with these overlapping, intersecting laws?
Yeah, great. So let's go to the next slide so we can see some of the specifics of these requirements and also where they're being rolled out. And I'll say that this is kind of the latest trend. This is actually something that we don't have yet in Massachusetts, which is somewhat surprising. But really, it's sweeping around the country. And you can see the list here. And I'll be honest that this list we prepared a week ago, it might not even be up to date as of today. So you have to really carefully track these laws if you are operating in multiple states and cities, jurisdictions. So basically, just the overview of these is that the laws require employers to post on job postings, including internal promotions in some places, pay ranges. And so that's why I was saying a moment ago that it helps to actually have those pay ranges already set out for different positions, because then it's not a matter of trying to figure out what to put on the posting when the time comes and if you end up being covered by one of these laws. And as I mentioned at the very beginning of this, the goal really of these laws is to address that disconnect in information available to employers versus employees. And we're actually seeing that being addressed in various ways where employees are becoming more vocal about pay, sharing their pay more in the workplace because of the trend we just talked about. Also, we've seen a lot of action on LinkedIn and other social media sites where there's conversations about pay now, and I've seen people posting their pay and getting really a lot of attention talking about why they're posting their pay. And the goal really of these laws and a lot of that activity is to take away that advantage that employers have, where employers have the knowledge about how much people are getting paid for certain positions within their entity. And so that's the goal. I'd say we haven't seen much. We don't know yet whether that goal is being achieved in these places. And again, we don't have it yet in Massachusetts, but it has been proposed. So I wouldn't be surprised if we see a similar law coming up, in I'm not sure when, but in coming years, next year or two, maybe. And so to address your question, Kristen, about how healthcare employers are complying with these laws. So employers who are covered by different jurisdictions, what we're seeing is they're not really laying out different requirements in each place and trying to tailor their postings to each jurisdiction's requirements. Instead, what we're seeing is that employers are often studying the laws to figure out which has the strictest requirements, and then really just rolling out job postings in all locations to comply with that, with the understanding that a lot of these different states and localities are just piggybacking on each other. So in other words, California was, I think, the first one to pass this a couple of years ago now, but theirs is not the most employee friendly, applicant friendly anymore because of what other states have done that have been more kind of progressive. And so now California is trying to catch up and proposing legislation to match, for example, Colorado, which applies its job posting requirements to any remote work that could be performed from anywhere for an employer in Colorado. And so that's just an example of why employers are considering trying to be just the most complying with the most employee friendly requirements in all places to avoid trying to have to keep managing these different requirements. But another thing that employers are doing really to address all of these various types of laws is having an internal champion. So appointing someone on the team internally who's really in charge of tracking compliance with these laws and tracking updates to these laws. And I know that sounds obvious because that's really what employers have to do for all employment related laws. But this is an area where we're seeing so much rapid growth that we recommend definitely having someone specifically assigned to this area.
That's great, Hillary. And I just want to, amplify the point that you made about this, not only in the environment of hybrid and more remote work, which even hospitals who need to, of course, have people on the front lines, have many of them, seems to me, in our region in the Northeast here and across the country, have been leaning into remote work for people who don't need to be in the physical plant or in the patient-facing environment. Have sent folks to far-flung locations and allowed them to work from there. So the notion of needing to pay attention to how these jurisdictional requirements affect your organization in a way that maybe is different than it would have done in 2020, just definitely worth keeping your eye on. And the notion that, in some of these locations, promotional pay range disclosures, is another sort of, in terms of your workflow, probably something that requires a second look and may not be, the kind of hygiene or practice that you had adopted before these laws, state laws and regional laws were in place. So definitely worth a second look, and as Hillary suggested, having a champion roll up their sleeves and make sure that you're achieving compliance across your entire platform. The fourth trend that we wanted to discuss, next slide please, is pay reporting requirements. And really that is just a move toward reporting pay data in multiple jurisdictions, California and Illinois most notably. But we can talk about, Hillary, whether this is coming to our region, sort of as you just did, the stay tuned notion that there may be legislation proposed, and if so, what can healthcare employers do now to ready themselves for that?
Great. Next slide, please. So there's nothing in our region yet, so we won't focus too much on the details of these requirements in California and Illinois. We have some high-level points there on the slide for any of you who may have operations in those locations. But as Kristen said, this is the most recent trend. This is about reporting data to the government. And I'm not aware of any proposed legislation in Massachusetts or nearby. So please, if anyone is, feel free to put a comment in, because as I said, this is changing regularly. But one thing that our healthcare clients in this region are doing to get ready for this, assuming that it may come to Massachusetts sometime soon, is conducting privileged pay equity audits. And so we recommend, of course, before any employer provide data to the government, that the employer conduct a privileged audit internally using counsel. So when I say privileged, I mean in-house counsel, usually involving also outside counsel, to review, usually using a statistical model, their pay, to identify any disparities and to get on the right track to address those disparities before being required to report any data to the government. And so I wanted to emphasize a couple of words there. Number one is privileged. And so whether it's in-house counsel or outside counsel, the key to having a privileged audit is that then the employer later gets to decide what, if anything, to share as far as the audit that was done. And that ties into also this Massachusetts law that we discussed at the very beginning that has the self-audit defense. If an employer wants to take advantage of that audit, they would have to decide at that time whether or not to waive the privilege. But if the audit was not privileged in the first place, there would be no decision point and the employer would have to share the results of that audit. And that is, of course, a very daunting task. And so I think moving on to our final best practices slide, Kristen, I see we only have a few minutes left here.
Sure.
I think
so in light of that, given that we have so few minutes left, I just want to read the CLE code, which is for those of you who are tracking your CLE hours. You've got a half of one here, and the CLE code is SS2616. Again, that is SS as in Seyfarth Shaw 2616. And so, as Hillary said, next slide, Dave, with so many competing compliance requirements, how do we get ahead of this? How do we prioritize getting buy-in and resources to conduct the privileged pay audits that you were just discussing, and thereby take advantage, at least in Massachusetts, of that affirmative defense. Hillary?
Yes, so we've got 3 key strategies here on the slide. Number 1, we just talked about conducting that privileged audit really as soon as possible. One thing I will say about timing is that we recommend when an employer is considering adjustments as a result of a privileged audit, that the employer align the adjustments with the annual cycle. In other words, roll those adjustments into the annual cycle, as opposed to having a separate adjustment timeline. And so when you're considering when and if to conduct a privileged audit, we recommend starting at least a few months before that annual merit cycle in order to allow time to be able to add the adjustments to that cycle. Because again, we typically do not recommend discussing the fact that the employer is doing the audit with the employee population. And so any adjustments would be, the reasoning would be kept privileged, and the adjustment would be rolled into a merit cycle without explanation as to the pay equity basis. The second is really that job classification and grading system that we talked about a few moments ago, which is to have a architecture around pay. And so to get away from having manager discretion define and describe pay, and instead have an overarching system that hiring managers look to place applicants within ranges. And that really helps to avoid a lot of the pay differences that we see when we conduct privileged audits, and that employers then have to try to figure out whether there's a justification for and decide how much and when to remediate. And so, and then the other tip, of course, as we mentioned, was to have someone that's really in charge of addressing these issues. And so one thing I wanted to talk about, another reason why we wanted to explain why privileged audits are important, is that we see a lot of class actions in the wage and hour space. And so that's what I spend the majority of my time doing. I do pay audits and wage and hour class actions. And that could be FLSA, federal law, or it could be state law. But what a privileged audit will do is to help the employer to group employees and identify those risks where there could be a class action and try to get ahead of it. And class actions are a particular risk for employers because, number one, there's a lot of employees involved, so that just means increased exposure, but also there's mandatory attorney's fees involved. And in some jurisdictions, including Massachusetts, there's mandatory treble damages. And so those cases become, we create a lot of exposure for employers really from the outset. So the privilege audits allow employers to get ahead of those.
And I think we've done just a stellar job of staying right on schedule. I know it's a lot of information for folks to digest. We understand with the workforce challenges that the healthcare industry is facing these days, particularly staffing challenges. You are uniquely, I think, challenged by the, needing to staff up and perhaps hire traveling nurses and other clinicians to ensure that you're providing, as you do, quality patient care at all times in all units. So we understand that you've got a lot of nuanced issues to attend to and deal with when you're approaching these sorts of issues. So we recognize how challenging it is to navigate this landscape. We do think that bringing yourselves together in a privileged capacity or in a safe environment, taking advantage of anonymized data and benchmarking when you can get it, and relying on trade associations and others who can help you, navigate, get a better understanding of pay practices in a way that doesn't violate any antitrust concerns, are all other additional best practices that should be considered and should help educate your teams as you try to navigate these choppy waters. Lastly, before we end, I just want to invite you to attend our next webinar, not the healthcare team, but the wage and hour team, which Hillary and I both belong to here. We're going to be conducting a webinar on the Mass Peculiarities book that we just published, which talks about wage and hour issues in Massachusetts in particular, and how those issues differ from other jurisdictions, and make it a bit of a challenge to employ employees here in Massachusetts and pay them correctly on time every single time. So join us August 2nd for that webinar. Thank you for joining us today. We really appreciate your being with us, and happy to see you again down the road. Thank you very much.
Thank you.